If we look at the frontline treatment of ER-positive breast cancer, really there has not been any new agents shown to be effective other than anti-estrogen agents. We do know that everolimus is approved in later line therapy, but in this first line indication, really palbociclib is the first new agent for these women. And the significant efficacy balanced by a side effect profile that is fairly manageable. The most common side effect toxicity we've seen really has been neutropenia and leukopenia, and the package label has guidelines for managing that. In general, palbociclib is given on a 3-week on, 1-week off regimen, and that 1 week off is to allow for recovery of the bone marrow. The bone marrow suppression seen with palbociclib appears to be different than that seen with cytotoxics or chemotherapy type drugs, in that the recovery appears to be fairly quick. The length of the neutropenia is fairly brief, and we do not see a significant incidence of neutropenic fever. So that is a big advantage as compared to cytotoxic chemotherapy. I think still there are several options for women with advanced ER-positive breast cancer, but based on the expedited approval, this is the option, I think, with very strong efficacy data. The study was 165 patients randomized. Some people might want to wait for a confirmatory study, which is ongoing and completed accrual, and the results are awaited. That is the Paloma 2 study, which is a large double-blind placebo-controlled study. But I think the FDA is interested in getting promising new drugs to patients as soon as possible, and that is why we saw the expedited approval of palbociclib.